Welcome to The Explainer. Today, we are tackling something huge, the nursing exam. We're going to break down a mountain of study material into one single, powerful mental model that you can use to nail almost any clinical question they throw at you. So if you're in nursing school, you know this feeling all too well, right? You're staring at this absolute mountain of information. Cardiac, maternity, pharm, you name it. And it all leads to one massive high-stakes exam. It feels impossible. How in the world are you supposed to memorize it all? Well, here's the secret. You don't. You don't just cram facts. The trick is to learn how to think like a nurse. It's all about using a simple, repeatable framework that just cuts through all that noise and gets you straight to the right answer every single time. And this is it. We're calling it the nurse's golden rule. Seriously, this is the core framework that's going to simplify any clinical scenario you ever face, whether it's on the NCLEX or right there on the hospital floor. It's really just a three-step process. First, you have to ask yourself, what is the single biggest, most immediate threat to the patient? Think airway, breathing, circulation. Then, second, what's your goal here? Usually it's to get the patient stable and stop things from getting worse. And finally, number three, what is the single safest, most immediate action you can take? Not the most complex or the smartest sounding option, but the safest thing you can do first. Okay, so let's really dig into that first step, finding the threat. Everything, and I mean everything, starts right here. Before you do anything, you have to correctly pinpoint the immediate danger. Is it their airway? Are they bleeding out? Is there a raging infection? Getting this right directs every single thing that comes next. A huge part of spotting that threat is knowing the difference between what's normal and what's a giant red flag. Take aging, for example. The changes that come with getting older are usually slow, kind of gradual. But sudden confusion or acute shortness of breath, one-sided weakness, oh no, that is not normal aging. Those are urgent threats screaming that something is seriously wrong. And this right here, this is pure gold for any exam you'll ever take. The word sudden is your number one clue. The second you see that word in a question, your brain needs to light up and scream emergency. That one word signals that the threat is happening right now. Okay, let's try this out. Imagine you're in the ICU and a ventilator alarm starts blaring. Your first instinct might be to go mess with the machine, right? To just silence that annoying beep. But hold on, what's the real threat here? You always, always, always assess the client first. The threat isn't a noisy machine. The threat is that your patient might have a blocked airway or isn't getting oxygen. Maybe they need to be suctioned or they're biting the tube. The patient is always the priority. The equipment can wait, the patient can't. So once you've locked onto the threat, like that potential airway problem, the framework logically moves you to the next step, picking the absolute safest action to deal with it. And this is just a brilliant illustration of that idea. Let's talk about deep vein thrombosis, or DVT. There are lots of safe things you can do to prevent it, but there's one action that is critically unsafe. You never, ever massage a patient's calf if you think they might have a DVT. Why? Because the threat isn't just a sore leg. The threat is that you could dislodge that clot and send it straight to their lungs, causing a massive, life-threatening pulmonary embolism. Okay, here's another high-stakes one for you. Your patient has a spinal cord injury and all of a sudden their blood pressure shoots through the roof. This is a medical emergency called autonomic dysreflexia. What do you do first? Before you even think about calling the doctor or grabbing meds, the very first, safest, and fastest thing you do is sit that client straight up. It's so simple, but it's brilliant. This one move uses gravity to help blood pool down in their legs, which can immediately start to lower the pressure in their brain and cut down the risk of a stroke. It is the perfect example of a safe, immediate first action. All right, now let's really put this framework to the test with some rapid-fire versus battles. This is where the golden rule just shines, helping you instantly tell the difference between conditions that might seem similar and really sharpening your clinical judgment. First up, IV problems. Infiltration is when the fluid is leaking into the tissue, so the site gets all cool and puffy. Phlebitis, on the other hand, is when the vein itself is inflamed, so it's warm and red. The signs are different, but the threat is damage to the tissue or the vein. So the safest first action for both? It's the same. Stop the infusion, period. Next up, fluid balance. Just look at how opposite these signs are. With fluid overload, everything is, full. You've got swelling, crackles in the lungs, bulging veins. With a deficit, everything is dry, and the body's trying to compensate with a fast heart rate. Seeing these patterns helps you nail down the threat right away. Now, this is a huge one in obstetrics. Early decelerations in the fetal heart rate, generally okay. It's just the baby's head getting a little squeezed. Your action is just to monitor. But late decelerations, that's a massive red flag. The threat is that the baby isn't getting enough oxygen from the placenta. So you have to intervene, and fast. You turn mom on her left side, give her oxygen, and crank up the IV fluids, all to get more oxygen to that baby. And finally, a distinction that is literally life or death. Asystole, flatline, is not a shockable rhythm. You do not shock it. Your priority is to start high-quality CPR. But ventricular fibrillation, that chaotic electrical mess on the monitor, that is shockable. Your top priority is to defibrillate immediately. Picking the right first action here makes all the difference. So there you have it. You see the pattern, right? In every single situation, you find the threat, you clarify your goal, and you execute the safest first action. This isn't just some trick to pass a test. This is the bedrock logic of good clinical judgment that's going to serve you for your entire career. And just think about it for a second. This framework goes way beyond the hospital. When you're facing any tough problem, whether it's at work or just in life, what would happen if you just paused and asked, okay, what's the real threat here? What am I actually trying to achieve? And what's the safest first step I can take right now? It's a surprisingly powerful way to get clarity on just about anything.